Right now, reach up and gently press your fingers. Just below your ear, along your jaw, and down the sides of your neck. Feel anything unusual? A small lump, a firm bump. Something that was not there before? If you have, you are not alone. And you are right to pay attention. Because a lump in that area is one of the most common reasons people quietly worry for weeks before finally seeing a doctor. Today, we are going to end that uncertainty. Most lumps behind the ear or under the jaw are completely harmless. But some are not. And the difference between a lump you can safely watch and wait on and a lump that demands urgent medical attention comes down to a handful of specific warning signs that most people do not know. By the end of this video, you will know exactly what to look for, what questions to ask, and when acting fast could genuinely save your life. Let's start with the basics. Your neck, jaw, and the area just below your ears contain hundreds of lymph nodes, small, bean-shaped organs that are part of your immune system. When your body fights off a cold, a throat infection, or a dental problem, these nodes often swell up as they filter out the bacteria and viruses. This is called lymphadenitis, and it is entirely normal. The swelling is usually tender to the touch, moves freely under your fingers, and fades on its own within 2 to 4 weeks once the infection clears. The problem is that not every lump in that area is a swollen lymph node fighting a routine infection, and the characteristics that distinguish a harmless lump from a dangerous one are not always obvious, especially because the most serious ones often do not hurt at all. Here are the 5 warning signs you must know. The first is persistence. A lump caused by infection should shrink and disappear within 4 weeks as your body heals. If a lump has been present for more than 4 weeks without getting smaller, especially without any obvious infection, this is a clear signal to see a doctor without further delay. Medical specialists worldwide consistently cite persistence beyond 4 weeks as one of the top red flags for malignancy. The second warning sign is hardness and fixation. Benign, infection-related lymph nodes feel soft or slightly firm and move easily when you press them. A lump that feels hard like a stone or rubbery, like an eraser, and does not shift easily under your fingers because it seems attached to surrounding tissue, requires immediate medical evaluation. This is one of the most reliable physical distinctions between benign and potentially malignant lumps. The third sign is the absence of pain. This is the one that confuses people most. Many assume that if something does not hurt, it cannot be serious. In fact, the opposite is often true. Cancerous lymph nodes and tumor-related lumps are frequently painless. If you have a lump that has been there for weeks and does not cause any discomfort at all, that lack of pain is not reassuring. It is a reason to get it checked sooner. The fourth warning sign is size and growth. In adults, a lymph node larger than 1 centimeter in diameter is considered abnormal. If a lump measures more than 2 centimeters across, feels hard, and appears to be growing gradually over weeks or months, this should never be ignored. The combination of size, hardness, and slow, steady growth is a pattern that specialists take very seriously. The fifth sign involves accompanying symptoms. Unexplained weight loss of more than 10% of your body weight within 6 months. Drenching night sweats that soak through your clothing. Persistent unexplained fever or extreme fatigue lasting for weeks. Any of these, combined with a persistent neck or jaw lump, form a pattern that demands urgent medical attention. In the medical world, these are called B symptoms, and their presence alongside a neck lump significantly raises the concern for lymphoma or other serious conditions. Now let's look at what specific conditions can cause a lump in the area just below your ear, because understanding the possibilities is what separates informed awareness from blind panic. The most common serious cause is a problem with the parotid gland, the largest salivary gland in the body, located directly in front of and just below your ear. Tumors of the parotid gland account for about 80% of all salivary gland tumors, and the majority of those are benign. The most common benign type, called a pleomorphic adenoma, grows slowly over months or years and feels firm but movable. However, even benign parotid tumors should not be ignored. Left untreated, some can transform into malignant tumors. When a parotid tumor is malignant, It tends to feel hard, fixed, and may eventually press on the facial nerve, causing numbness or weakness on one side of the face. Any lump near the ear that grows rapidly, or is accompanied by changes in facial movement, is a medical emergency that requires same-week evaluation. The second major concern is lymphoma, a cancer that starts in the lymphatic system itself. Lymphoma typically presents as firm, rubbery, painless swelling in one or multiple lymph node regions simultaneously. You might notice swelling not just below the ear, but also in the armpit or groin at the same time. Global research shows that the 5-year survival rate for Hodgkin lymphoma is approximately 89%, and for non-Hodgkin lymphoma around 74%. Those numbers rise dramatically with early stage detection. Stage 1 and Stage 2. Lymphomas respond to treatment at significantly higher rates, which is why recognizing the signs early is not an exaggeration to call life-saving. The third condition is metastatic head and neck cancer, meaning cancer that began somewhere in the mouth, throat, tonsils, larynx, or nasal passage, and has spread to the nearby lymph nodes. The neck lump is often the first visible sign that something is wrong in those areas. Research consistently shows that head and neck cancers, diagnosed at an early stage, carry a cure rate above 90%. That figure drops to below 50% when the disease is found at a late stage. That gap, more than 40 percentage points in survival, exists simply because of timing of detection. A growing concern in recent years is HPV-related oropharyngeal cancer, which has been increasing rapidly worldwide. This type often presents as a firm, painless lump on one side of the neck in adults between 40 and 65 years old, sometimes without any obvious symptoms in the mouth or throat. Anyone in this age range with a persistent, unexplained, one-sided neck lump, especially with a history of smoking or alcohol use, should specifically ask their doctor to evaluate for HPV-related cancer. So what happens when you visit a doctor for a neck lump? Understanding the process removes a great deal of fear. Your doctor will begin with a thorough history: how long the lump has been there, whether it has changed in size, whether you have had recent infections, and whether you have any accompanying symptoms. A physical examination follows, carefully assessing the texture, mobility, and size of the lump. From there, a neck ultrasound is usually the first imaging test performed. It is quick, painless, uses no radiation, and can reveal critical information about the internal structure of the lump and whether blood supply patterns suggest benign or malignant tissue. If the ultrasound raises concerns, a CT scan or MRI may be ordered for a more detailed view. The definitive diagnosis comes from a biopsy, a procedure where a small sample of tissue is taken from the lump for microscopic analysis. Most biopsies in this area are performed with a fine needle under local anesthesia, which takes only minutes and causes minimal discomfort. The fear of this procedure causes far more harm than the procedure itself, because avoiding it delays diagnosis. Here is the personal checklist you should use right now. If any one of the following applies to your lump, please see a doctor this week without delay. Has the lump been present for more than 4 weeks? Is it hard, like rubber or stone, and does not move freely? Is it completely painless? Is it larger than 1 centimeter and visibly growing? Is it accompanied by unexplained weight loss, night sweats, fever, or profound fatigue? Has any facial weakness, difficulty swallowing, or voice change developed alongside it? Even one of these factors is enough to warrant professional evaluation immediately. On the other hand, if your lump appeared alongside a clear infection, such as a cold, sore throat, or tooth pain, if it is soft and tender to the touch, if it has been noticeably shrinking over the past 2 to 3 weeks, then continuing to monitor it, while treating the underlying infection, is a reasonable approach, as long as you reassess at the 4-week mark. The message I want you to leave this video with is simple. A lump below your ear is not automatically cancer. The vast majority of neck lumps are benign or related to manageable infections. But the ones that are not benign give you warning signs, and now you know what those signs look like. Knowledge is not scary. It is the most powerful tool you have. And if the worst case were ever true, catching it early gives you a cure rate above 90%. That number is on your side. If this video gave you clarity or helped someone you know, please like and subscribe, and share it with anyone who has been quietly worrying about a lump they have not yet had checked. Your comment about your experience or questions is always welcome below. Stay informed, stay proactive, and take good care of yourself. See you in the next video.